Good afternoon. This is an oversimplification of basic thyroid function tests interpretation in the usual pattern or straightforward case. Assumes that you have combination of thyroid function test, 3T3, 3T4, and TSH. First, look to the thyroid hormone. If they are low, then this is hypothyroidism. If they are high, then this is hyperthyroidism. Then look to the TSH. If TSH changes are in the same direction as free hormone, then this is a secondary hormonal disorders. If TSH changes are in the opposite direction, then this is primary hormonal disorder. Here, low thyroid hormone, this is hypothyroidism. Low TSH, then this is secondary hypothyroidism. Here, low thyroid hormone with high TSH, this is a case of primary hypothyroidism. High free thyroid hormones, then this is hyperthyroidism. With low TSH, then this is primary hyperthyroidism. High free thyroid hormone, this is hyperthyroidism. With high TSH, then this is secondary hyperthyroidism. If free thyroid hormones are normal, but TSH is high or low, then this is subclinical case. Again, this is an oversimplification because in routine clinical practice, we start by ordering TSH alone, followed by ordering 3T4 if TSH result is abnormally high or abnormally low. If TSH result is normal, thyroid disease is highly unlikely. This is a brief overview of the common thyroid disease. Subclinical hypothyroidism is defined as low TSH and normal 3T4 and 3T3. The disease is a pure biochemical definition. Low TSH, normal 3T4 and normal 3T3, and not a clinical definition. Subclinical is misnomer. Patient may have symptoms, although often asymptomatic. When symptoms are present, they are similar to symptoms of overt hyperthyroidism, insomnia, weight loss, palpitation, tremor. And symptoms, if present, generally play a role in whether therapy is considered or not, but not in making the diagnosis. The patient need monitoring or follow-up or periodic reassessment of thyroid function tests as some patients may progress to overt hyperthyroidism. To treat or not to treat. To sum up, subclinical hyperthyroidism. It's a pure biochemical definition. Low TSH, normal 3T4, normal 3T3. Subclinical is misnomer. Patient may have symptoms. Patient may progress into overt hyperthyroidism. Patients needs periodic monitoring. Patient with subclinical hyperthyroidism may need treatment. Subclinical hypothyroidism, it is a rising topic all over the world. It's a mild thyroid failure with isolated elevation of TSH, normal 3T4 and 3T3. Subclinical hypothyroidism is a pure biochemical definition. High TSH, normal 3T4, normal 3T3, and not a clinical definition. Subclinical is misnomer. Some patient may be asymptomatic, or 30% of patients have symptoms. The most common, the disease has a high prevalence, relatively high prevalence. Most common cause is Hashimoto, so many patients have positive anti-microsomal antibody. Many cases are transient and spontaneously normalize. Thyroid function test normalize spontaneously in up to 40% of patients within 2 years. Because subclinical hypothyroidism may be due to thyroiditis or non-thyroidal illness, which usually spontaneously resolve, repeat thyroid function testing 3 months after the initial testing is recommended to exclude transient cases. That's to say, don't depend on single TSH measurement to make a diagnosis. Repeat TSH after 3 months. The disease is divided into 2 categories. Patient with mild elevation of TSH less than 10, and the patient with more severely elevated TSH more than 10. The patient may be at risk of progression to hypothyroidism, overt hypothyroidism, or presence of hypothyroid symptoms or cardiovascular complications. To treat or not to treat. To sum up, subclinical hypothyroidism, mild thyroid failure. It's a pure biochemical definition with high TSH, normal thyroid hormone. Subclinical is misnomer, as some patients are symptomatic. Symptoms are those of overt hypothyroidism. The disease may be transient, so we have to repeat thyroid function test after 3 months to exclude transient case. Patient may have symptoms of hypothyroidism. Most common cause is Hashimoto, and many patients have positive antimicrosomal antibody. Symptomatic patient, particularly those with TSH more than 10, may need treatment.